everyone, and welcome to Cellular Healing TV. I'm your host, Meredith Dykstra, and this is episode number 177. We have our resident cellular healing specialist, Dr. Dan Pompa, on the line, and today we welcome special guest, Antje Waxman. So before we dig in, let me tell you a little bit more about Antje. It's a very fun show today, and just a little forewarning too, if you can, definitely check out the video version of this show versus the audio version, because Antje is going to be giving some very cool demonstrations on her expertise, which is posture. So, all right, Antje Waxman is the owner and instructor of Realign in Charlottesville, Virginia, through Egoscue University. And she's a certified postural alignment specialist through Egoscue University. Egoscue method has a 95% success rate in reducing chronic pain without drugs and surgery. Antje is also a certified Smovey coach, Nordic walking, and NIA instructor, and that stands for Neuromuscular Integrative Action. She's developed specific programs for people who want to live pain-free and improve their health and return to functional fitness. Antje has helped hundreds of clients restore their health and live pain-free. In personal and group sessions, she educates and motivates people to understand how alignment is connected to degeneration and pain. She believes that correct alignment is an essential foundation for good health and fitness. Antje works with people of all ages and fitness levels, and also with people who have arthritis and Parkinson's. And she's going to take us through her two-step program for pain-free living and a healthy body. So welcome, Antje, to Cellular Healing TV. So excited to meet you and learn about your technique.
Hi, Dr. Pompa. Hi, Meredith. Nice to see you. Wonderful. Thank you so much for inviting me today. I really
Listen, I know our viewers, and like she said, I usually say viewers and listeners, but hopefully you're viewing this show. So viewers are going to really be blessed. Dr. Mercola and myself, we were down visiting you and Dr. Bush, and you really took Joe and I separately through the Egoscue. Am I saying that correctly? Egoscue, is that the?
Yes, Egoscue. Comes from Pete Egoscue is the founder.
Yeah. So I want you to explain what that is. But we were blessed because I didn't know what it was, right? I think Joe knew a little bit, but we both left there and we said, "Wow, that was such a blessing." First thing Joe said to me was, "Hey, are you going to do all those things? Are you going to do all the exercises?" He was. Joe's Joe, right? I mean, he planned on it. He was testing me out to see. I said, "Absolutely, I'm that guy," right? Because my back pain. And one of the things, when you looked at my posture, and I'm not far away like you, but you could demonstrate because you saw my posture. I was leaning forward. Yes. I couldn't even believe that was the way I was, right? I mean, I had this forward lean posture, and one of my problems was this chronic low back tension, right? That won't go away despite doing everything. I mean, the best chiropractic, the exercises, stretching, I did it all. And when I saw that, I thought, oh my gosh, that's putting so much posterior tension on my extensors that, that's it. So you immediately developed a program for me, just like you did Joe, based on our posture. And I could tell you, and I said this, to you, it's really the only thing that really helped. That it seemed like it took pressure off and it made me more stable. So I've been doing it for the last 2 months. I don't know, gosh, was it 2 months now since I've been there? I don't know how long.
2 months, yes.
Yeah. So, and I've been faithful at it so much. I was impressed that you did a Skype session, with my wife, and you lined up her exercises based on some of the postural things that she had going on. So she just started. So I can't give testimony there yet. But actually, she said it was helping, honestly, already, and she just started. Right. So anyways, that was my experience, and I got really excited and said, you have to do a show. I mean, we get hundreds of thousands of viewers, and many of them need this, so hopefully you'll offer your services to them too. So what is this? What is this? Where was it developed? I mean, how come I never heard of this before?
Right. Thank you so much, Dr. Pompa. It's wonderful to be here, and I'm very passionate about my work. Because I have been going through pain by myself at some point in my life, and so I do understand pain. And chronic pain can show, it can be very different. It can be severe pain or not so, let's say, chronic pain that's nagging, but there's a tension. And the Egoscue method, where if I may tell you my brief story. When I moved to the US 17 years ago to marry my American husband, I developed rheumatoid arthritis, and really so badly that I had inflamed joints everywhere. And I knew that it was an autoimmune disorders, a system disorder. And I started healing myself naturally with supplements because I didn't want to take the immune system suppressing medications. So, but what happened to my body when I had, let's say, a swollen knee, it was not arthritis like osteoarthritis, it was inflammation, then I immediately compensated on the other side. And that means I had pain there too. So I got into a very vicious cycle. So very often when there's pain on one side, then the other side compensates and there's pain too. So the Egoscue method, I learned from a friend about it, is a non-medical pain relief postural alignment therapy that I love. I love it because this therapy is, first of all, very popular and has helped thousands of people worldwide. And I like the non-medical approach. So there's no medicine, there's no steroid involved. Mm-hmm. So what we do is, as an Egoscue practitioner, we are looking at the entire body. We are not just looking at symptoms. So for example, when somebody comes to me with lower back problems, I will not necessarily give him lower back exercises, because I'm looking at the entire body, the upper back, the head position, the ankles, the knees, and my goal is to find out not necessarily what the condition is. I'm trying to find out the position. I mean the position of the joints. So something else in the body might actually cause the lower back problems. And as you said, you're leaning forward, right, when I took the photos of your posture. So we are also looking at the body. Where's the body in terms of the gravity center? So some people lean forward, some people lean backwards or side to side, and there's immediately a compensation in the body. So as an Egoscue practitioner, I also believe, we all believe, that the body has the innate ability to heal itself.
Right.
And my goal is, because I've helped myself and many other people, my goal is to help my clients to teach my clients how they can help themselves.
Yeah.
Right.
So, yeah. So how does it work? Okay. So, I mean, you saw me in this forward lean position. So my pelvis was anterior or forward from my center of gravity, basically. Right. And then, okay. And then I think I had a little bit of rotation in my pelvis. It was all compensation.
Yes.
And then you went to your computer, and then you basically figured out through this method what exercises that go with that particular postural misalignment. And then you said the order is very important too. So I have certain stretches, I have certain exercises that I did, and some of things where I would say, okay, I wouldn't have thought that would be a part of this, I mean, but it is. So how does it all come together, and kind of describe that?
So first of all, what I do is I look at all four weight-bearing joints. That's my first. So they should line up horizontally, the shoulders, and vertically, and create a 90-degree angle. So if my shoulder is elevated, or let's say my hip is elevated, there's already stress, in your case, let's say in the spine. If in addition to it, in rotation, let's say hip rotation, very often people have an elevation on one side and a rotation on the other side. There is immediately stress in the body. So, and in addition to it, in your case, you were leaning forward. That means you were in extension all the time, in extension, too much in extension. You were moving and leaning forward. So and do you remember I took some photos of your posture after the first session? You were much more in the gravity center, and that means from the side view, means that the ankles, the knees, the hips, and the shoulders, and the ears should line up. Mm-hmm. If this is not the case, there is tension in the body, and the body is desperately trying to avoid pain, but at some point there's pain. And this is Yeah.
How is this developed? Because I mean, it is a very unique method, you know, and I mean, I know that people get it done, and I mean, it affects their energy, their sleep, because remember, I was a chiropractor, but when I was doing chiropractic, I was a structural correction guy, right? I explained to people how their structure affects the function of their body, you know, how, from their energy to their sympathetic, parasympathetic balance, how it can affect. So, you know, I get that, but most people watching this don't, you know, so that's one part of the question. The other part is how was this developed? I mean, who, you know.
Right. You know, habits can develop this. So so also a gait, faulty gait can develop that. So just an example, I don't know what happened to you, but definitely when you were standing there, you were leaning forward. So some people, sometimes there's no reason for that. But for example, sometimes I work with musicians, and they have, let's say, a violin player constantly has his arm lifted. So there is a, you know, at some point there is a deviation. There is this arm is not in the right position anymore because he's lifting it all the time. I don't know, maybe you're rushing a lot. I don't know, through the.
You know, in my case, I think, you know, I'm a skier, and we're trained to lean forward,
right.
You know, constantly forward. And even in our boots, we're leaning forward. So that was the only thing that I would think that put me in that forward position. But, you know, what I actually meant was, how was the system developed, the Egoscue? How was this developed? I mean, who figured this out? How did it happen? And it's been around in Germany for a while, but.
Not in Germany. Egoscue is from San Diego, California. So Peter
okay. Yeah.
There. This is not. Egoscue, the credit. He's the developer, and you know, he developed that in 1971, and he was in the Vietnam War and was injured, and then the physicians told him that he probably will have to live in pain for the rest of his life. So this is what he developed it and looked at different movement forms. It's kind of a combination of different movement forms. We do have yoga exercises, as you know, right? I mean, we have. So we also work with the wall and the floor. You know, if somebody is leaning against the wall and does not feel comfortable, like somebody like you, like leaning forward all the time, that is an indication that the body is out of alignment in terms of the gravity center. You know, so if some people with rounded shoulders, they have a problem with that as well, to lean against the wall. So you might, as I said, you might be skiing or you're rushing all the time. Then another thing can be the pelvis. I know you have an anterior pelvic tilt, so your pelvis goes a little bit to the front, right? And so that is, many people do this. They lean forward because of that. And then this creates even more tension. Other people who have a posterior pelvic tilt like this, they sometimes lean to the back. So the pelvis, that is the heart of we call this the heart of the body, the unit, is very often also responsible for these misalignments.
So maybe you could show them some. I mean, this is different for everyone, folks. So, you know, don't like say, oh, okay, that's my, you know, she puts together a whole system. And there is a sequence, and you told me the sequence is very important. But with that said, you know, give us some examples, like show some of these exercises. For example, let's say you have this and this, you know, just so people can see, because right now everyone's going like, okay, I don't get it. What is she doing?
Yes. So let me first, would you like me to show you an exercise, for example?
Yeah, I want some examples, maybe 2 or 3.
So for example, what I do with my clients, I take photos and then I upload them in a system so that I can really see where's the postural misalignment. And then I also do a functional testing. For example, like when people bend forward and they never reach the floor, they might have an upper body problem that has an impact on their lower body. So there's so much to consider: joint position, also muscle imbalance that creates created through the joint misalignment. But so very often the pelvis is the first thing that we look at, and also the upper body and the lower body. So there's one exercise, very simple exercise that has helped many people. It's a corrective static exercise, and what you have to find is a block or a chair that brings your body in a 90-degree angle, and then you just lie in this position. So in this position called the static back, the lower back is flattening is slowly flattening into the floor. So there's already a relief for the body and the spine in this position. So people who go into this position feel immediately very, they feel that the tension in their shoulders, in their upper body, in their lower back really is eliminated. And
this was one of the first ones that I started with, just to get me to, my back relaxed, and then it progressed from there.
Yes, exactly. So I call this always like neutralizing your pelvis. This is a wonderful exercise to start to neutralize your pelvis, because most of the people I see, they have a hip elevation and rotation, and in this position, your body cannot be rotated, your hip cannot be rotated or elevated, and this has also an impact on your shoulders. So yes, so once I have looked at my clients or at your body, I design a specific program that works for each person. So let's say there is one person who comes with lower back pain, might get a total different exercise program than another person, because I look at the entire body as a unit and find out what is not working. And then let's say the upper body is rounded and there's a C curve. Then I work on the upper body so that the client or the person can find the relief in the lower body. Does that make sense?
Yeah.
Yes. So I'm looking at the entire body, also the ankles. One client had a dysfunctional ankle, because I also do a gait analysis. And this dysfunctional ankle had an impact on the lower back or upper shoulders.
Let me tell you something. Two things that you had me do, and my thing is you assessed that my ankles were part of the problem, right? And I'm thinking, I don't know, maybe, I don't know. Well, you had me lay on the ground and twirl my feet. I was like ready to show it here, but I can't. You could show it better than I. Anyways, and it was so hard. It was so on my right side worse than my left. Yes. My right side, I could barely go in rotations. I would get to like 20 and I would be like in tears. So you should see me do it now. I'm like really good at it now, but it stabilized a lot of my balance point. I didn't realize was out of balance, especially on the right, more than the left, which was causing imbalance. So having to do that made a dramatic difference. Then also, my calves, my Achilles tendons were super tight. So a lot of the stretches were actually stretching that out, which had a dramatic release in my low back too. But show what I was just talking about, because I was in tears. I couldn't believe how hard it was.
Yes, exactly. And so that means so as we know now, you were not in the gravity center because you're leaning forward, but you also have a balance problem or had a balance problem in your body. So there was maybe, because of one hip elevation, more weight on one leg than the other. So, and that means that also changed the ankle function and the flexibility. So you mean the foot circles here? Yeah, they are really tough, if I may show it. Mm-hmm. So you stretch out one leg, and then this is also a very good test. So one leg is stretched out, and you flex the ankle, and the other leg is keep the knee still, so you don't want that it is shaking, and then you roll your ankle 40 times in one direction, and then 40 the other direction, and then 40 forward and back. And most of the people I work with, they have just functional ankles, and that has such a huge impact on the entire body.
I know people are laughing at me right now because I said how hard that was. And I know people just watch you do that and they're like, a what? Okay, by the time I got to the second exercise and by the time I got to 30, then when you did the forward back one, I couldn't even finish. I was in that much pain. And now I've gotten better, but it's made a dramatic stabilization, just like you said, in my balance and everything. My right side was horrible. Yeah, so I it's harder than you think, folks. Now here's the thing: just by doing these now, and now Meredith can get testimony of this. We interviewed a gentleman on, and he was talking about the benefit of the squat, right? And I'm like, I can't squat even for like 2 minutes. I fall backwards, right? So I was already working on this squat. And then when I started doing this, it was like, I mean, I'm telling you, it was like I can squat now. I can literally squat and hold a squat without falling backwards or like laying completely forward. So anyways, I mean, what does that mean? It means that, I'm opening up my hips, my knees, and I'm more flexible. Yes. And ultimately for me, it took tension out of my low back. So Meredith, you probably have questions because you're an outside looking in. She's done this for Mally and I. And, so you probably have a lot of questions that somebody else watching this would.
Right. Yeah. Thank you so much, Antje. It's very, very interesting to learn this technique. And I'm just, I'd love a little bit more clarification too. How is this different than a lot of other postural therapies out there? For example, years ago, I did a Feldenkrais, which kind of has to do with fixing your posture and alignment of your system to help it function better. So how is it different than some other therapies? And also, would you use it in conjunction with some other postural alignment therapies, like chiropractic, for example?
Yes. So I would say all postural alignment therapies have probably the same approach. That means we want to help people to feel better and to be without pain or live a pain-free life. And the Egoscue method is still very unique, as it, first of all, as I said, looks at every body or each body as a unit. So we observe each person in a different way and make a decision what kind of exercises this person gets. For example, very often in other postural alignment techniques, they're like Alexander techniques, and others, people get the same exercises for the same problem. So Egoscue, people who want to learn about Egoscue will find out we are not doing that. They get a total different exercise menu than another person with the same problem. So, and that is one thing. And there are also the combination. There are exercises that I have not seen before in my life, such when we do exercises standing against the wall. And they are so Egoscue created a very unique exercise form with different combinations and techniques. Also Pilates, there are some Pilates exercises that are similar, so yoga exercises. It's a combination almost of everything.
Mm-hmm.
Yeah. I love the customization too. So the plan for the athlete would look a lot different than the senior citizen and versus even the child, right? It's good for all ages.
Yes. I have been working with children and especially teenagers, and because in our today's time with all the cell phones and computers, say they're all hunched over and their head is forward. It's really sad to see this. And they can succeed very quickly. They very often only need one exercise menu. That means it exists of, let's say, 5 to 10 exercises that the kid has to do on a daily basis. And they change very, very quickly. So it's so to recommend to do this when parents see their kids already hunched over, because later they will have the problems and will suffer at some point, from pain.
Mm-hmm.
Right. So would those be kind of some of the more common things you're seeing with the hunched over, and I would imagine the neck, like the cell phone neck, and what are some other things that you see that are pretty common postural alignment issues?
So what I see, so Peter Egoscue, he wrote different books, and I will show them a little bit later. And he actually has been analyzing types of posture types. So I see very often women have and I will bring it up here again, have a rotation, let's say a counter rotation here, a rotation here, and then let's say a hip in this direction. Very often women, and Peter Egoscue wrote a book about it and analyzes people like these are skeptical people who have a lot of rotations. So then it very often almost 60 or 70% of the people I see have rounded shoulders. Their hands are like here.
Yeah.
They're not supposed to be here. They're supposed to be here. So if you go to airports, watch that. The backs of the hands are usually always on the front. No, they're supposed to be here casually without any military posture, but they have to be here. And what happens when we have this correct posture, when we grab things and reach out, we do it very differently than if we do it in this posture, for example.
Mm-hmm.
And also, what I also see a lot is leg and knee and ankle, faulty ankle positions, for example. And then people like valgus knees, so people have knock knees, rotated ankles, and that has such an impact on the hips.
Oh, gosh.
And or let's say bow legs, they are walking on the outside of their feet, and then they wonder why they have hip problems. So, but they usually get, then at some point they have hip problems and then they have a hip surgery, but the original root cause might have been the legs because they were faulty. And I have a lot of clients with, they had already signed signed in for a hip surgery, and even also people who are 70 plus and they didn't have any surgery. I have to say it's work though. They have to work.
I remember hearing about the clients. I hear my echo. She was, I don't know, maybe 70s or 80s, and she was thinking you couldn't help her much, right? She was very in the old person posture. And now she was like this, but like more vibrant, more energy. You told me all the things that changed. So for any age, obviously.
Right, exactly. So it's not only head upwards. Many people think of posture as only rounded shoulders, but there's posture, as I said, hip, pelvic tilts in all directions, knee and ankle positions, head. Also, people with migraine, they have, let's say, a tilted head and they don't know why. They have habits. For example, very often also people who cross their legs, sit on a sofa, always the same leg, they have at some point dysfunction in their hip, or of course, if you're really sitting in a sofa and you don't sit upright, that has an impact too. There are so many habits that can cause different rotations from side to side and front to back.
And one of the things I think we're seeing an epidemic of is anterior head position. I know when I was doing structural work, it was so prevalent. And if you look around, especially the younger generation, their heads are here. The hours on the phone, hours at computers.
Yes.
Every inch your head moves through the center of gravity, it doubles its weight to your muscles, right? So if you took a bowling ball and held it here, you could do it. That's how our head's about, 8 to 10 pounds. And we could hold it here, but every inch you move forward, it gets heavier and heavier relative, right? Because you don't moving to the center of gravity. That's what your head's doing. Not to mention, it stretches your spinal cord. It's called tethering, which affects every aspect of your health, including your digestion. So, that's I know that that's a big deal, and retraining is what the system does.
Right. And there's another, right, sorry, yes. And there's another thing that I see, because I work in a fitness center here as well as a freelancer in Charlottesville. I see people working out, let's say lifting weights, and then they have a deviation. Let's say shoulder is elevated or rotated. Can you imagine what it does to the muscles? So they lift weights and they are out of alignment. So they actually, athletic people, they create such an imbalance in their body. And when I see that, I very often, I look away, because I see how people work out and it's not healthy. It's dysfunctional workout.
Well,
so, yes,
when I see people jogging.
Yes.
Okay, and it's typically women for whatever. Okay, they have their feet falling in. Their knees are valgus. It's like their posture's terrible, and they're running. And I just want to go up and say, stop. It's like, I know you think this is healthy, but you're destroying your knees, your ankles, your spine. It's like, I just want to say, stop. And I don't know why, but it's like I said, it's more women than men.
Yes.
again, you probably have the answer to that more than I do, but it's an odd thing, but it drives me nuts. And I point it out to my wife every time.
No, you're totally right, and I see this all the time. It hurts me when I see that, because I already know I have made my forecast. Oh my gosh, this person will get some knee problems or hip problems or even upper back problems, because it is just faulty how they run. And this is why I love functional movement. So when people do their specific exercise programs that, as you said, are in a specific order, so one exercise builds up or prepares the body for the next exercise. And that's one point that I love about the Egoscue method. Then I also do a functional training after that, because then finally people can start walking correctly with a correct posture. And because I believe in walking, so walking, running, as long as it is healthy. But most of the runners, as you said, or walkers even, they are walking forward or lean to the back, and they have valgus knees or bow legs, and this has an impact.
Yeah, they're heading for trouble. So you mentioned in the beginning that this is incredible for people with Parkinson's and neurodegenerative diseases. What kind of results are you seeing there, and why is it so good for that?
With the Egoscue method?
Mm-hmm.
Yes.
Yeah.
Yes.
Yeah. Mm-hmm.
So yeah, it is good. So I also work with the Smoveys there. So I have been working with people with Parkinson's and the Smoveys are rings that I have discovered in Austria. But so people with Parkinson's very often have the tendency to lean forward because their nervous system doesn't work right anymore. And I have been working with one of my clients for years. So whenever I come to him, he can't get himself up anymore. Parkinson's, as you know, it's a neurological disorder, but it also has an impact on all muscles in the body. So after that, they find relief and they can walk a little bit more upright. And unfortunately, after, let's say, a few days, they go back down because, in general, I prevent the body from getting worse and not staying here all the time. So the digestive system, also the breathing, is breathing a very, very big factor, that the breathing is getting better. So we also have a lot of exercises where people just lean against the wall and go from side to side. Just doing this is for many people very, very difficult to handle because their bodies are so much out of alignment. Mm-hmm. So, and I also work with people with Parkinson's, also with the Smovey rings. That's because they also have an impact on the brain that has nothing to do with the Egoscue.
The moment you showed me those, I said, I want those things. So you have two exercises that all of us can benefit from.
The Egoscue exercises, you mean?
Yeah. So there are two exercises that you were going to show, that being one of them, the rings. Yes. So go ahead and show the rings and, show these things, these two exercises that we all can benefit from.
Yes. I can show you two exercises, Egoscue exercises first if you want, on the floor. Is that okay? Without the rings?
Yeah.
Yeah. So as I said, find a chair. Bring your legs up on this block. These are two of my favorite exercises. And now find a cushion or let's say a ball, like for children, like something like that, something that has some resistance. And now squeeze the object slowly. So this is a block, but you can also use a paper towel roll if you don't have anything else, but it should not be too soft. So you squeeze your knees and let go, squeeze, let go. This is very nurturing for your lower body and your back. So we are engaging the back muscles and the inner thigh muscles while the body and the pelvis is in alignment. That is so if that is the big difference. If I would do it in a standing position, it would be different. But my pelvis is in alignment while I activate my adductors, so my inner thigh muscles and my back muscles. Another very effective exercise for people who have a tendency to rounded shoulders is we are interlacing our hands.
My wife does this one because she has rounded shoulders.
Yes, you keep your elbows straight. You don't have to go, you know, like in yoga, you don't have to go to the floor. You just move forward and back and breathe.
Your exercise.
This is, one of my favorite exercises. It stretches the entire upper back while your pelvis is in alignment. That is the position, and your lower back cannot compensate or do something else. So this is a great exercise.
So my wife just showed up. So when she was doing this, I'm like, oh my gosh, I did it. I was, helping her.
Yeah.
And I'm like, it's so easy. She couldn't even do it. She was in pain. She was like, oh my gosh, it's so hard. So again, it's because it was specific for her. You knew by looking at her posture. So, but it's.
Yeah, I just got back from doing my exercises actually. Every day. I'm there like 5 or 6 days a week. It takes a good hour.
I know. And yes, and I know, and it is a lot of work, but the good thing is, Marilee, at some point you will have a maintenance menu, exercise menu, and that will be shorter. It will just keep your body in alignment, so you don't have to do this for the rest of your life to invest so much time. We also want, or my goal is also to help you to feel a difference, right? I mean, if people come to me and say, I have 10 minutes every day, then I say, okay, we can do it, but I don't know, it will take some time, until your body changes. So it is good to invest at least, let's say, half an hour, 20 minutes to half an hour, and if you want to succeed, or if people want to succeed more quickly, they should do a few more exercises. And then later, yes.
I have that brachial neuralgia. So actually today I did this one for a minute, but after a minute here, and a minute here, I'm blown out. So honestly, my shoulders are really bothering me today overall. So I just did this one. I just opted out of the other two, which I've never done before, but again, my shoulders are just so sore that I'm trying to figure out ways to not exacerbate what I'm already dealing with.
Right. And you can always adjust it. You mean the standing wall clock or the kneeling wall clock?
Right. That's exactly that one. Yep.
Yeah, it's a tough exercise. But you can also adjust it time-wise in not doing it.
Sure. I'm just so intense.
Hey, look at these. You got to show her the rings. She's saying
like this, and
this. So the 10 and 2 and the 3 I opted out of. But what about this? So I have a question, because on the shoulder rolls, right?
Yes.
Are your shoulders just slightly in front? So I should probably take this off.
Yeah, I can't.
So
yes, so you roll your shoulders, and here's the point. Really up. Yeah, very good, Meredith. So up to the back and down. Most of the people.
So pretty exaggerated.
Yeah, up. Yeah.
Yes.
I think my son Daniel was trying to get me to stay in smaller.
No, you really want to go a big circle. And the same thing when you go to the front. So it's not just up and down. It's really like a circle. Up and also down.
So much clicking and clacking in there. I mean, I don't know what happened to me.
Well, you know what? A lot of these things, they look so simple, but when they're for you specifically, it's working little muscles in the nerve supply to those little muscles that are very weak and out of balance. So, it's like, like that for Marilee is very difficult, right? It's like because she has so many little muscles that just aren't firing and working and they're out of balance. So.
Oh, yeah. Honestly, I mean, believe it or not.
She's so strong. But it's these little stabilizers that are so weak, and that's part of the problem.
That is right. I grew my shoulder when I was working out with my son. I mean, he did so good by me until I actually had this muscle and didn't have the stabilizers and the ligament, the pressure and the strain of the ligaments to support it. And of course, being perimenopausal didn't help matters either.
Right.
Now I'm in a whole, it's just interesting. I have this evolution of learning that I'm doing even in my physical body. It's always something, right?
Yes, that's true. But as you mentioned, the Egoscue method, we also work with primary muscle groups, but also with what we call lazy muscle groups. Lazy muscle groups are also between the shoulder blades, along the spine, because of our posture that we are in many times or often. So we are waking up these lazy muscle groups that don't work anymore. And usually in therapies.
I've been doing it, 3 weeks now? Honestly, I've been there 3 weeks already. I would say since May, I think you sent me my first one, maybe May 24th, I think, because that's the one I actually have to talk to you soon and figure out how to load that out, because I have not yet done that.
She's going to hijack the show.
Yeah.
All right, listen. All right, here's the deal, though. I want you to show those rings. You see these rings?
Okay. Here it is.
And by the way, before I forget, make sure if people want you to help them, you can do it via Skype like you did earlier. I was with you in person, but how they can get your services, and I know they can get those rings because I want those rings.
Yes. Thank you so much for pointing that out. So yes, my office is located in Dr. Zachary Bush's Wave Clinic. So I'm here in Virginia, and if people don't live in Virginia, so they can visit me and make an appointment, of course. And if
I had dinner with Zach Bush last night, Dr. Bush.
Oh, nice. Wonderful. Great. That's great. Yeah, I love the clinic and I love being part of it. I mean, I'm very grateful. So yeah, and if people want to have a session with me, I also do online sessions like I did with you, Marilee. So people send me photos that they will get some instructions how they have to take the photos. I will review them, and then I will meet up with them via Skype or Google Hangout or other internet possibilities. And and then I can see people, I can see and assess the posture via Skype very, very well. And then I will design a personalized exercise program for their body and their pain and tension in their body. So if you want to reach me, the best way is through my website. So it is www and then realigncville.com. So it's REALIGNCVILLE.com. But if you enter, and there's another website now that we have created, postureandmotion.com, but you have to enter it in the browser, then you will get the Realign Cville site as well. So, and there is a specific discount for your viewers and listeners. We are offering 15% discount until July 15th. For everyone who has contacted me within this time. That doesn't mean that the session will happen within this time. But if you're interested, we offer this for a 15% discount.
Great. Yeah, Meredith, make sure we put that email in, some of the writing so people can get that if they missed it.
Yeah. So, thank you so much. Yeah. So yeah, that would be wonderful. And here's my passion. I want to help you to succeed. That is my personal approach. I really want to help you to succeed and to take responsibility for yourself. That is my passion. It is so rewarding for me when I see people who are pain-free and they can jump around. And even if you're over 80, it's something for every or all ages. I have several examples where people succeeded beautifully with 85, 86, and they changed their entire posture and feel much more healthy and more active than they felt maybe 15 or 20 years before. So that is a wonderful thing.
Yeah. Okay.
Yes. So here are the Smoveys, right? I wanted to show that. So the Smoveys are rings, green rings that are filled with 4 Qigong balls. And when I swing these rings, you can hear it. These balls are moving from side to side. So in Austria, there was an athlete, a tennis player, who engineered these rings because he was in a very progressed or advanced stage of Parkinson's. He could not speak anymore. He could hardly walk. And he engineered these rings and healed himself to a point that he still has some problems, but he can walk and work out and he speaks again. This is his true story. And in Germany and Austria, these Smovey rings, I will spell it S-M-O-V-E-Y rings, are very popular because they are not only working on the body, they are also working on your brain, on everybody's brain and the lymphatic system. So people with neurological disorders it's very good for them to use it, but also for everyone who wants to become fit and healthy and function again. So first of all, as you can see, these rings, when you swing them, they have only a pound, they weigh only a pound each. You know, it's a great range of motion for your upper body. I mean, when I see people walking, they don't even swing their arms anymore from side to side. And we also have, so we open up the chest. I love this movement. But so what happens, you know, while I swing the smoothies have a grip and they create a vibration in my hands while I'm swinging them. And they create a 60 hertz frequency in the body. And that is the same frequency that an embryo in a womb of a pregnant woman has. So it creates a stimulus in our brain, and it also works on our meridians while we work out. So we work on our lymphatic system, the meridians, and create chi flow while we work with these rings. So they are not heavy on purpose because we can create more weight if we go higher. For example, if we have more emphasis in the movement. The wonderful thing is, in Germany, the fitness industry looked at them and they found out, oh, wow, this is great. We can also do fitness with them and, you know, do some lunges or some squats and work out the entire body while we swing the rings. And there are also floor exercises, and you can also walk with them. And another wonderful thing is I personally have increased my balance. I mean, I never had bad balance, but you know, so for some people, you can also do some exercises to create more balance in the body. Or here, let's talk about squats. You swing your arms, so the arm motion is you are moving your upper body while you move the lower body. It's the frequency that ultimately is why it works with the nerve system and the lymphatic flow, right? Correct? Yeah. Correct. Yeah. So we have exercises for the lymphatic system. For example, underneath the arms there are a lot of lymph here, so you can rotate them underneath your arm. It feels really good. So for me personally, I use them when I can't sleep. So I get up at night. Sometimes I have too much on my mind. And I use them and I can fall asleep immediately. It's wow. Yeah, that's awesome. How do you spell that? Yeah. It's not a smoothie. It's a smoothie. It's a smoothie. It's S-M-O-V-E-Y. And if you want to go, I put on my site some information. But if you want to go and get more information, it's smoothienorthamerica.com. That is here. They are located in Los Angeles and in California. It's booming. Really, I mean, people buy them and feel the benefits for their entire body. So you're working out and do something for your nervous system. People become very calm when they use them and get out of it. Yeah, and they're also great for people when in a sitting position. So they can also do exercises while they're sitting. It's not a problem. Sorry. So they can even use their legs. They can get a great workout too. I personally have been starting to run with the smoothies, and it's really my range of motion, my shoulders is so different now. So this is my motion after I help people to get in alignment. They learn how to walk correctly again with their ankles, with their entire body, and they create motion in their body with these with the Smovey rings.
So they can get them on your website too?
Yes, they can get them on my website as well. And I also have a special offer for the viewers and listeners until July 30th. It's $168. They are not cheap, but you will not get them cheaper anywhere else. On Amazon, it's handled like a stock market. Now you get them almost for $200. It's really expensive because this is such a small company in Austria, and they work with handicapped people. So it's an Austrian good quality product. And 168, and there is no shipping costs until July 30th.
Send them to me. Just send them to me.
We want them. Yeah, I want to use it. Well, I mean, for the detox, it's fantastic, you know, and also postural correction, because frequency and vibration, that's actually how we used to correct posture. We would use certain frequencies to make those postural corrections. So, you know, I get that for sure. So, well, gosh, the time went so fast. I have to turn it over. I have another appointment. So, Meredith, I'm going to turn it back over to you. Asha, thank you so much. I mean, you know, what great information. I know it's going to be a great show, and I know you're going to have a ton of response for people who want you, you know, to help them like you helped us. So thank you for both.
Thank you. Thank you so much for inviting me. It was really a pleasure. And yes, if people want to email me, that's all on my website. They will see the information. They just have to fill out the form. So thank you for inviting me. And I will send you the rings, I promise.
Oh, man. Awesome.
Thank you so much. Have a great afternoon.
You too. Thank you so much. Thanks everybody for tuning in. I'm excited to try some of these exercises myself. So take care, everybody. Have a great weekend, and we'll see you next time. Bye-bye.